You stumble into the bathroom, do your business, and look down. Instead of pale yellow, the toilet water blooms crimson. Your stomach drops. You immediately assume you are suffering from massive internal bleeding. You're convinced you need to rush to the emergency room or burst into the nearest pharmacy demanding answers. But if you talk to a clinical pharmacist in that moment, they won't match your panic. Instead, they'll ask a remarkably calm question. Did you take any new medications last night? Every time you use the restroom, you are looking at a daily diagnostic report generated by your internal organs. These color shifts are a chemical language describing how your body processes everything from water to medications. To read that daily diagnostic report, we have to look closely at the complex internal machinery that is actively generating it. Your kidneys function as the body's ultimate smart plumbing filter for your circulatory system. The kidneys retain essential nutrients while diverting excess water and waste. This contains urochrome, a hemoglobin byproduct causing the baseline yellow color. Kidneys also flush out food dyes and drug metabolites, mixing them to generate entirely new liquid colors. Understanding this chemical dialogue between your blood and kidneys reveals a simple truth. A sudden, shocking color change is rarely a failure of your body. Most of the time, it is just the filter doing its job flawlessly. Let's look at this safe spectrum chart. Completely clear urine means you're overhydrated, stripping necessary electrolytes and salts. The biological gold standard is pale yellow, indicating perfect hydration balance. If it darkens to deep yellow, you are dehydrated and need water immediately. Occasionally, you might produce a shocking neon or phosphorescent yellow. There is zero reason to worry here. This is strictly the result of your kidneys harmlessly flushing out excess B-complex vitamins. And that brings us back to the panic of seeing orange or light red. Frequently, it's just from eating beets or a heavy serving of carrots. It's also a standard side effect of several common medications, like the antibiotic rifampicin or over-the-counter UTI painkillers. Taking a quick mental inventory of your diet and prescription side effects before reacting prevents a massive amount of medical anxiety. Pharmacists aggressively educate patients on this so they don't panic and abandon their life-saving treatments over a harmless color change. However, there are strict clinical warning signs that exist entirely outside the bounds of food dyes or drug side effects. These are the explicit red lines of your body's diagnostic report. The first major red flag is unexplained blood red urine, clinically known as hematuria. As you can see in this medical illustration, the blood is often caused by a jagged kidney stone causing microtears as it blocks the urinary tract. It can also indicate heavy, severe infections or even tumors. If the color resembles dark brown cola, you are facing a critical emergency. This signals either active liver failure or a rapid, severe breakdown of muscle tissue, known as rhabdomyolysis. Persistently foamy or heavily cloudy urine acts as a different kind of alarm bell. Thick foam points to protein physically leaking from damaged kidneys, while a cloudy appearance usually indicates a severe, pus-filled infection. The rule here is non-negotiable. If you experience unexplained red, brown, or persistently foamy urine, you must seek immediate emergency medical care, even if the symptom only happens a single time. There is one very specific mistake you must avoid. Do not reach into your medicine cabinet to take leftover antibiotics at the first sign of cloudy urine. Cloudy urine can frequently be a harmless concentration of salt crystals. Blindly treating those crystals as an infection drives a mechanism called antibiotic resistance. By exposing bacteria to unnecessary drugs, you inadvertently breed stronger, deadlier strains that become incredibly difficult to treat. The only definitive tool capable of separating a harmless chemical imbalance from actual disease is a clinical urinalysis run by a medical professional. So rely on these two takeaways. First, your baseline urine color is your ultimate daily hydration thermometer. Keep it pale yellow. Second, unexplained red, dark brown, and persistent foam are clinical red lines that require a doctor, not guesswork. Checking these colors and maintaining consistent water intake ensures your kidneys stay operational and your diagnostic reports remain clear. It is the simplest way to track your health before a minor imbalance becomes a clinical emergency.